Hi everybody, my name is Kunle Pelemo. You can call me KP. I'm asking you to join me every Friday, 5:30 p.m. GMT on the MHAASP show right here on MZ Radio London. It's a show where we talk about mental health and suicide prevention. Set a reminder for that. And just before I go, I want to let you know I care about your mental health. And you know what? Stick around right here on this station. Don't go nowhere. Don't go nowhere. This is the MHAASP show. Okay, my name is Kunle Pelemo, and I'm glad to have you join me on another edition of the show. Today's show promises to be another wonderful show, exciting, bumper package, anything you could call it good, because we have someone who is joining me in the house, in the building, like I normally say. So we've got KP in the building, and then we have somebody else in the building. And together we're going to have a good time talking on an important topic that you can't afford to miss. Like someone that on MZ Radio London, AP Radio UK, the MHAASP show is on, that that person should just tune in, stick around and join us for another, wonderful time as we discuss mental health awareness and suicide prevention. Okay, let's hit the show running right now, and let me introduce my guest to you. Who is my guest? As she is fondly called, Dr. Adetoun is named one of Africa's youngest change agents and social revolutionists. She's a multi-preneur, the MD of PRONTOTHERAPy, an offline/online based service provider where on-the-spot therapy is being rendered to individuals, corporate organizations through talk therapy sessions, and suicide rates are minimized or completely erased through that. She's also the founder of the EYINJU Foundation, an NGO born out of passion for mentoring, motivating, sensitizing younger ones who are being referred to as the leaders of tomorrow on the importance of being relevant, thriving in the society and generation, as well as running a Feed the Destitute bi-monthly program through that same foundation. She also runs a successful travel and tourism business called Tush Travel and Tours. My guest today is a bundle of so many things, a bundle of talents, and she's here to talk which she is passionate about. Welcome to the MHAASP show, rather, Dr. Adetoun Adewoye. You're welcome. Dr. Adetoun, welcome.
Thank you. Good evening, KP. How are you?
I'm doing great. How are you doing?
I'm very well, thank you.
So good to have you on the show today.
Thank you for having me as well.
In spite of your busy schedule, I know how busy you are. And you made it. Thank you. So glad you made it.
Thank you, too, for inviting me. I hope the listeners can actually learn one or two things from what we're going to discuss today.
I can't wait. Yeah, so let's go straight to the business of the day. We're talking about psychotherapy, when we were discussing what we're going to talk about, and I saw the passion in you to really enlighten people, when it comes to psychotherapy. And I said, woo. So let's make it happen. So first and foremost, what is psychotherapy? So our listening audience can know exactly what it is.
It's quite simple, actually. Psychotherapy you can define it as the use of psychological methods, particularly when it's based on regular personal interaction with adults, to help a person change their behavior and overcome problems in desired ways. It is just them speaking up, which is the first aid. Psychotherapy actually is the first aid of mental health. So it's them speaking up before a psychiatrist can actually diagnose what's wrong with them and know if they either need medication or if they can go for proper therapy.
Okay. Okay. Now, I mean, you are a psychiatrist and then you are also passionate about mental health. Can you just let people understand basically what might be the difference? Because what people fear most when it comes to mental health might be the fact that they will say, I mean, it has to be associated with lunacy or madness or something. Let me put it straight that way. So when you ask someone to go check on his mental health or our mental health, they would say, no, when I'm not mad, something like that. So can you just make people understand what the difference really is sometimes? You may unmute.
Can you hear me now?
Absolutely. Yeah.
Oh, okay. I said in this part of the world, a lot of people don't give cognizance to mental health just because there's a stigma attached to it. Like you rightly said, when you talk about mental health in the midst of people, they think you have to be at Yaba Left or you have to be at Arrow in Abeokuta, like, or you have to be roaming about the street before you're regarded as a mentally heal person. But there are a lot of people walking around that they are facing anxiety, panic attack, depression, schizophrenia. It's a whole lot. So when it comes to mental health, it's just it's a very wide aspect of the health sector, which the health sector actually do not give give recognition in court to, just because they feel that all other types of diseases, and the general practice when it comes to medicine is much more important than mental health. And I know they know this actually. They know that people have to be mentally sane for them to be productive. So just the way you go to your medical doctor who is a cardiologist that deals with heart, or a pediatrician, or any other kind of aspect of medicine, it's just the way you will come to a mental health doctor or a psychiatrist or a psychologist, and then treat yourself. It's just you, like psychotherapy that we're talking about. It's just you opening up to somebody and talking. Some people, all they need is just a listening ear to listen to them, and they are good. Some they just need someone to tell them, okay, this is what you're suffering from. Okay, apply this method, do this and do this, and then they are fine. And then they just come out of their depression, or if they don't come out once, they come out gradually, just because they begin to apply the techniques you've given to them. You get? So mental health is very, very important. Is pretty important. Like anyone that wants to be 100% productive, either spiritually, physically, financially, career wise, in any aspect, you have to watch out. And you have to take good care of your mental health. And it starts from self-care. Caring for yourself in a way that you know that it won't cause you to break down mentally. Yeah.
Wow. Wonderful. Wonderful. I'm just thinking now, I've had a couple of people, I've had conversations with them, so to speak, talking about the cause of the demonization, let me put it that way, or stigmatization of mental health. From your own perspective, and I know that you worked, what do you think is responsible in every society? Because what we're trying to do now is to see how to destigmatize mental health in the public space, in every society. So this is an awareness that is not just based on one geographical location. So from your own perspective, what do you think is responsible for the stigmatization that mental health normally received, based on your experience and your personal conversations with people who might be your patients or your clients over the years?
Okay, I think the stigmatization behind this is I really, I really can't place, I really can't place something on it. But I grew up to know that there's stigmatization attached to mental health, and it has just been like this because a lot of people are not enlightened. That's just the truth. If we have what mental health needs right now is more candor and unashamed conversations. Like you can go to just the way you regularly go to a doctor when you're when you have headache, or you go to the pharmacy and all that. You can actually, if there are centers that are tagged mental health, if there are centers that are created for mental health practitioners to actually practice, and people are aware of it, I think a lot of people would actually come to therapy more, just because they know that obviously there has to be an oath of secrecy. So they would know that it's a safe place for them to come and talk about their problems. And at the end of the day, their problems would not be, their issue would not be a CNN news or BBC breaking news. So if the health sector can actually have that, if they can have that, if they can create that department where people can just come and talk, and they know it's a safe place for them to talk, I think a lot of people would actually take mental health more serious and know that when they have issues that they need to talk about or is worrying them, they can actually come to those centers and get the help they need. So it's just about enlightening a lot of people, advocacy, let people know that mental health is not the end of it. It's not a death sentence. You can actually you can suffer from bipolar disorder, from schizophrenia, from addiction, insomnia, and all of that, and you can actually get help when you need it, even without the medications.
Wow.
So if they know that they can get help, immediate help, I think a lot of people would actually come, they will come to therapy. It's just for people to know exactly what mental health is. And once they have that knowledge, it would erase the knowledge they grew up with, like, you being mad or whatever before you're termed a mentally ill person. So I just think it needs more advocacy. More people need to know what exactly mental health is. So when they mention mental health, they can actually be an advocate and tell, like, two friends can be together and the other one is suffering from depression. If one has a good knowledge of what mental health is, you can easily advise your friend and say, okay, this is what you suffer from. Can you please talk to a therapist? It will be easy.
Wow, that's
easy.
That's true. And that's what, one of the things we are sold out to doing on the show, creating awareness about mental health, bringing in resource people to come and reach out to a whole lot of people. And that's also one of the things you are also doing, personally, and what you're doing right now. So thank you so much once again.
Thank you
for
too.
coming on the show.
I'm really happy that this program is actually on and it's on mental health. I'm very, very happy. Well
Thank you so much. Thank you so much. Now we will go into psychotherapy. Proper now, to let us into how it works. Things that I entail in psychotherapy, what people should expect, and how it's going to help